Consultation, pre-procedure preparation. The clinician, in this case a radiologist, meets the patient in the radiology suite prior to undertaking the fine needle aspiration (FNA) procedure, sometimes referred to as a biopsy.
Hello, Mr. Lopez.
Okay.
Could you just tell me your date of birth, please?
2nd of April, 1985.
Thank you. And your address, please?
101 Oxford Street.
Thank you very much. Okay. So, as you know, we've done the ultrasound. You have got a little lump in the neck. It looks like a lymph node. And your doctor, Dr. Smith, would like us to take a sample of this node. The way we do it is we use a very thin needle and just pop it into the gland using ultrasound to guide us. All right?
Yeah.
And then I'll hand the specimen to the cytology technician who's going to look at it straight away and make sure I've got a satisfactory answer. Now, you won't get the answer today, but we just need to get the sample done. Okay?
Yeah.
Now, the reason we're doing it is to come up with the diagnosis, because we don't know whether this is anything or not, okay? So, as I say, the procedure is a neck node biopsy. The benefit is to make a diagnosis. Okay? Now, any procedure we do carries some risks. Now, this is a very safe procedure. The needle I use is very small, and it's very unlikely you'll have any problems.
Okay.
The main risk with doing a neck biopsy is causing bleeding. If you bleed a lot, it could press on the windpipe and cause difficulty breathing, but I've never seen that before, and that would be very rare.
Okay.
Is that okay?
Yeah, that's right. Thank you.
The radiologist proceeds to complete a patient consent form for the FNA procedure.
Now, firstly, I'm going to give you a little bit of anesthetic in the neck.
Okay.
Not everybody does, but I think it's better to give a little bit of anesthetic, and that helps with the stinging and pain afterwards, okay?
Yeah.
Now, before we do you, are you allergic to anything?
No, just far as I know.
No. Do you bleed abnormally?
No.
Okay. And finally, are you on any anticoagulants or blood thinners,
No.
such as heparin or warfarin? No. Have you had any aspirin in the last week?
No.
Excellent. Okay. So, are you happy with what I've said?
Yeah, that's fine.
Do you understand everything?
I do, yeah.
Okay. So, should we go ahead and do the biopsy then?
Yeah, please.
Very good. Please could you sign and date the form? Just read through it to make sure you're happy, and then sign and date the form.
A consent form is not completed in all instances of fine needle aspiration.
Just going to fill out the cytology form quickly while we're here. 109276. You're an outpatient, aren't you? And you're under Dr. Smith. So we're going to do an ultrasound guided biopsy of your right neck. Okay? Just that little node we've seen. Alright? So you've had this node for 2 months, haven't you?
Yeah, that's right.
Okay, and that's all we can see. Findings. So the diagnosis we don't know. And you've never had cytology or histology before, have you? And you've never had chemotherapy or radiotherapy before, okay? So, I think that's fine. We'll go and crack on with that now.
All areas of the non-gynecological cytology request form should be completed, including details of the requesting clinician, date, clinical details, FNA technique, site, and side. Confirmation of patient details by biomedical scientist.
Morning, sir.
Good morning.
I'm a biomedical scientist from cytology.
Right.
Could you just confirm your full name, please?
Miguel Lopez,
And your date of birth?
2nd of April, 1985.
Thank you.